Women definitely experience jaw pain way more frequently, and that's thought to be the influx of estrogen and progesterone. But the other thing too is when people are clenching and they can't seem to turn off their clenching, I'm like, what else is clenching? Because if you're clenching your jaw, you're probably clenching your butt.
Everything. You're tensing your whole body. You're probably ab gripping, glute gripping, pelvic floor grip, toe gripping. I'm like, what is my tongue position? So what is the correct tongue position that we need to have, and what does it look like?
Yeah, so
Dr. Liana, welcome to the Female Blueprint podcast.
Thank you so much for having me.
I'm so excited you're here. Liana and I go way back, y'all. We started our business. No, actually, you started your business before I started my business. And then, yeah, I think so. And we kind of started around the same time, and we both are online virtual physical therapists.
Yeah, that we are.
But she's a jaw pain specialist, and I am so excited to talk to you guys all about jaw pain, the connection with all the pain with pelvic floor, everywhere else in the body. Y'all think that jaw pain doesn't matter, but it really does, and Liana's going to share the news today.
I am.
All right, let's get into a little bit about you first. So who are you and what brought you, to the world of jaw pain and treating TMJD?
So I'm Dr. Liana. Like Courtney said, I'm a physical therapist. I'm also a myofunctional therapist, and I actually decided to get that certification because of my interest in jaw pain. So how did I even get interested in jaw pain? Everybody thinks it's because of my husband, because he's an orthodontist, and they're like, oh, what a power couple. But that's not why I got into jaw pain. I was that like teenage kid that had a lot of popping and clicking and discomfort in college, discomfort in grad school with the stress of both of those things. And never really got any straight answers from anybody, did chiropractic, never did PT actually, until later.
Really?
I did didn't even do like the little like activator and I'm like laughing at myself now.
No.
Like, that was so stupid.
You're like the YouTube University trying to fix your own jaw pain.
Yeah, basically. Except YouTube wasn't popular back then. I was still on dial-up.
Yeah. Yeah.
And then in physical therapy school, I remember being the person that wanted to be evaluated. For every lab, people could volunteer to be evaluated in front of the class. And I was like, oh, me, because jaw's the only thing I ever had issues with. I didn't have issues with anything else. The professor looked at me, evaluated me. He's like, yeah, I don't know what to do with you.
It was that bad.
Well, I wouldn't call it that bad. It's just that we're taught in physical therapy school for hypomobile, so for people who are in closed blocks, people who can't open their mouth really wide. And that's just not me. I'm hypermobile. So it was something that people just didn't really know how to treat, especially when it came to the jaw. So that was always stuck with me in the back of my head. And then when I made my transition from inpatient, because I actually worked inpatient neurology for 3 or 4 years before I transitioned to outpatient. And in that transition to outpatient, I did dry needling, and I learned how to dry needle the face and learned all the muscle referred pain patterns, because believe it or not, that wasn't included in my education way back when. Because I graduated probably a good handful of years before you, and it just wasn't taught. And I was like, oh man, I missed a lot when it comes to the jaw.
I don't think I learned anything in PT school about the jaw, outside of anatomy and physiology. We didn't have any guest lecturers even talking about the jaw.
Yeah, we didn't either. In fact, if anybody has connections for guest lecturing at schools, please hit me up, because that's my next venture.
Avenue.
Yeah, avenue. But anyway, so going back to, I learned about muscle referred pain pattern, trigger points, dry needling of the face, and the person who taught that was in the physical therapy world, a craniofacial and orofacial pain specialist. And I was like, what? You can be a specialist in that field and as a physical therapist?
Yeah.
And on top of that, it was a woman, and I was like, yeah, that's awesome. She owned her own business. I was like, yeah, you go, right?
Yes.
and that just was when I walked home. Walked home. I actually drove home. I didn't walk home from the, but I went home,
She was
and I,
ambitious.
yeah, walked like 50-mile drive. No, I'm just kidding. Um, went home, told my husband, I was like, guess what? I was like, this is it. I was like, there's
I
so
know what
much
I'm
to learn
doing.
here. This is untapped. I was like, I'm passionate about it because it's something that I've been dealing with for my own life for a few, quite a number of years. And I said, and you're an orthodontist, so let's do this.
Mm-hmm.
He looked at me like I was nuts, but here I am.
Yeah. Okay, so I have so many questions to start. So you mentioned you were hypermobile and that do you think that's like the primary cause of your how did it start for you? Like what were the warning signs or like, people that are
Yeah.
listening to this and they're like, "Okay, I have jaw pain every now and then, but I don't know why." Like what
Yeah.
does it look like?
Yeah. So, I mean, I think right now a hot topic is like root cause. Like, what is the root cause to what you're
Yes.
dealing with? So, whether I actually truly believe like root cause or not, I think people want to know what that is. And for me, like, I think there is a hypermobile aspect to it, whether that's an HSD or HEDS diagnosis. I don't really know, but
Wait,
definitely
what's HDS?
HSD.
HSD for the
Yeah.
listeners. I mean, I obviously know.
Oh, hypermobile spectrum disorder. And
Okay.
then
Okay.
HEDS is hypermobile Ehlers-Danlos syndrome.
Okay.
Um, I
So
don't really
actual
know.
conditions like you've been maybe diagnosed with, but also those conditions fly under the radar too,
They
right?
do. I haven't been diagnosed with them, like truly diagnosed. But I have enough like symptoms on like the diagnostic criteria that I probably could go through and get diagnosed.
Mm-hmm.
Um, but that is definitely something that flew under the radar for a number of years.
Mm.
Probably just coming to light, having like known a few other the clinicians that we know today, and like just learning more about it because it's also something that we were taught in school that's super super rare, and as we know, it's not super super rare anymore. It's like close to 50% of the population is systemically
Yeah.
hypermobile. So that's definitely part of it. The other part is we see a lot of overlap and a lot of correlation between diagnoses and symptoms. And a lot of people with hypermobility also have what we consider tethered oral tissues. That can be lip ties, tongue ties, buccal ties, but essentially where there's an overgrowth of tissue, right? That tissue didn't retract with development in utero. And how
Wow.
that affects things is, let's say you learn to swallow in utero at like between 11 and 13 weeks, I think.
Mm-hmm.
And so if your tongue is tethered or doesn't have good movement, you basically learn improper swallowing, right? So that's where like a lot of kids maybe have difficulty breastfeeding or eating solid foods and things like that. But what that can then become is motor dysfunctions and cause
Mm.
jaw pain or oral development. And I've also seen that people who have tongue ties tend to have, especially with restricted movement, tend to have more movement in their jaws because the tongue and jaw kind of move together as a unit, which means that the joints have to pick up the slack.
Wow. I'm so interested in this. Okay, so you learn to swallow in utero, 12 weeks, let's just say 12 weeks.
Yeah, something like that.
How how do they not learn to swallow? Like, is there something that mothers do, or like, is it just like, oh, it's just, yes or no, you learn or you don't? Like,
No,
what causes that?
well, everybody has to learn, everybody has to swallow. Like that's how we
Right.
survive, right? And at the
Yeah.
base of like we see sometimes we'll hear kids like when they're babies that something called failure to thrive, where they're having
Hmm.
trouble really swallowing. Like that is can be a life or death issue for an infant, right? But a lot of times people we learn compensatory patterns, right? So that might be where people start to learn about my tongue thrusts forward, right? Because if the
Mm.
tongue can't elevate, it's going to thrust forward. And we learn compensatory patterns to swallow because, well, one, we want to eat, we want to survive. The body wants to live. So it's going to find the way to live.
Right. Wow. So, for somebody listening, obviously, probably no infants or children are listening to this podcast, but a mother,
Yeah.
postpartum mom, and listen to this podcast and they're like, okay, how do I know my baby has a tongue or lip tie or a buccal tie? Like, what is that looking like? And what would you recommend they do? Or is it just like a lactation consultant? Like, what does that look like?
Yeah, I mean, there's a number of clinicians that can help with this journey, right? A lactation consultant, specifically IBCLCs, dentists or other professionals who are educated in tethered oral tissues or TOTS. So that can be maybe a speech language pathologist, some pediatric
Okay.
physical therapists, like a bunch of people. There's definitely people who in the spectrum of providers that can help. But most symptoms that a mother may know or remember in her postpartum journey is like there was difficulty latching, maybe milk production didn't come, quickly or easily. Maybe they didn't produce enough milk. Maybe.
Does that have to do with if the baby is not latching, does that impact their supply? Obviously, if they can't get it out, like they have to go pump or whatever, right?
Yeah, so with the whole that that whole mechanism of stuff,
Yeah.
um, the pumping and breastfeeding are completely different to the body. Like even though it's still extracting milk, um, baby latching produces oxytocin, and baby not latching or pumping does not. So even though they're still extracting milk, it's different to the body. Um, then we have to talk about extracting milk. So if the baby's not extracting milk, then the body won't produce it.
Mm,
So that's another part of that whole supply issue.
wow. Okay. So now baby grows up and has all these compensatory jaw problems. What are like signs in maybe like young adulthood or even like teenage years? Because like for you, did you have pain since you were little or did it show up later?
No, I mean it showed up later. Like I mean I really just had popping and clicking as a teen, and then it wasn't until like college that I really started to have discomfort.
Mm-hmm.
Um, but signs as a kid that I had one, teeth crowding, like um, my teeth were crowded. I mean, they weren't overly crowded. My brothers were way worse. I didn't have braces as a teen. I actually skipped those and had that later. Um, so that's one,
Mm-hmm.
um, that I had. Others that people may have are maybe speech issues, like speech impediments,
Mm-hmm.
specifically like around S's, R's, L's, blend letters. Um, having the need for speech therapy. People who have like food aversions, whether that's maybe they don't like purees, maybe they don't like hard foods, hard chewy foods. So for a good length of time, I like didn't really eat steak. I just wanted
Mm-hmm.
fish, more softer
Something that was like
foods.
harder. Yeah.
Yeah. Um, choking, like people who have issues like either swallowing water or swallowing food and they choke frequently, or choke on their food. Yeah.
Wow.
Um, actually, that was like a big one of mine. I do choke on food. It has to deal with like motor planning on how you chew and swallow. But on my honeymoon, I was flying and I choked on a piece of chicken, and I literally thought I was going to die on my way to my honeymoon because we were like across the Atlantic Ocean.
In the airplane.
And
Oh
my husband
no.
had to like hit me on the. I was
Give you the
like,
old
yeah, it was
Heimlich.
almost like, yeah, it was bad.
Oh my gosh. Okay, so choking.
Yeah.
Wow. Um, so what are some things that if people start noticing these things, like what are the immediate first steps that they can do maybe at home or like whatever before they need to go see a specialist? If they started noticing these signs and symptoms either in their kids or themselves.
Yeah, I mean, honestly, don't research Google.
Please don't.
Don't.
Gosh.
I think the biggest thing, one, is there are some books that I really do like, and I think are very easy reads for people who don't have a like a higher education. Like they're very
Mhm.
easy for the layperson to read, but they're written by people who are clinicians. So
Mhm.
one of those books is Tongue Tied, by
Mhm.
Dr. Baxter. Baxter, yeah, I'm pretty sure. Then we also have Gasp by Dr. Michael Gelb,
Mhm.
as another book. And both of those books really kind of show the a whole variety of different presentations of what oral dysfunction can look like. So not even just jaw issues, right?
It's
What
opening your
other?
eyes.
Yeah, yeah. So those are really great books. I also think Breath by James Nestor is a good book to read. Um, The Oxygen Advantage by Dr. No, he's not a doctor, by Patrick McCohen, is also a good one. Um,
Okay.
and
Guys, find
I
those
feel like
books.
those just are easy, get them off of Audible, get them off of Amazon, read them, listen to them, whatever. But they just give a really good overview
Mm-hmm.
of what the potentials are, what's going on. Um, and then after that, definitely, if you're still considering, like, I have free resources, I'm sure. Actually, I don't know how many other people have a ton of free resources, but I have a lot of free resources.
Mm-hmm.
You're more than welcome to start there.
Yeah.
An ebook, things with, like, I have exercises that you can tap into and try. I have a 30-day program, that kind of stuff,
Yeah.
before you start diving into more specific treatment. But if you're kind of stuck, then the best thing to do is get an evaluation by somebody who is knowledgeable in this stuff. And like I've kind of mentioned before, not every physical therapist or speech language pathologist or dentist is very knowledgeable in these things. Definitely might want to do a little bit of background work on who you're
Like a
going to go to.
myofunctional therapist.
Yeah, myofunctional therapist, but even still, I find that when we're blending like jaw pain specifically and myofunctional therapy, that's still like a really tricky area, because
Mm-hmm.
a lot of the people who are myofunctional therapists don't have the rehab knowledge that, let's say, a physical therapist or maybe even an occupational therapist would have in terms of prescribing exercise.
Okay, so that's another question. So is manual therapy like the next best option? Like if they do go to a myofunctional therapist and they're just getting, I don't know, manual work on their jaw or like dry needling. I learned to dry needle the jaw when I took my course. And like I'm definitely not specialized or anything or know a lot about TMJD. And I would treat like just evaluate, I would get people in the clinic evaluate and treat. And I'm like, okay, let me do some manual therapy and some dry needling. But I didn't know exercises. So like if somebody else out there and they're like, wait, you can do exercises for your jaw, like what does that look like?
Not
Let's
what
see
we
it.
learned like in physical therapy school. Yeah, I probably have an arsenal of like close to
Yeah.
60 exercises.
Oh, you
Um,
guys, go follow her. She's got it all.
yeah, close to 60 exercises. And the biggest difference, I think, like you said, like I think those manual therapy, dry needling, all those things have a place and are honestly really helpful. Like when I see people in my clinic, I still do manual therapy. I still dry needle if appropriate.
Mm-hmm.
Um, but the exercises is really where it's at. And I think you can speak to this too with what you do.
Mm-hmm.
Is like we have to learn to like down regulate the system. We have to learn to upregulate the muscles that are kind of like not doing their job. And that's where a
Mm-hmm.
lot of the parallels between the pelvic floor and jaw lie, is like usually there's, a tight upregulated, and I hate to say tight, but tight's a feeling, but this
Yeah.
upregulated side that's not really functioning, and a downregulated side, or we see these patterns right between muscles or sides, and it's the same thing in the jaw. And I do think that with myofunctional therapy, although they're very good at assessing tongue ties and how the jaw is functioning, there's still just that disconnect with like how to really train a jaw,
Mm-hmm.
um, and um, build the musculature that needs to for people to feel relief.
Yeah.
Um, so
So, okay, so say, I mean, I always think of like before I knew about myofunctional therapy, like I'm like my dentist. And he told me this was like maybe when I was like after I had braces, when I was maybe like high school, college era, a night guard because I grind my teeth at night. So what is that about? Like grinding, clenching, is that like stress? Was I stressed at night? Like what is that? Or is that like a TMJD?
yeah, so I mean, you'll hear there's like there's a few different reasons why people clench,
Mm-hmm.
grind. A
So I
night
feel like I
guard's
don't
not.
do it anymore, or at least I don't notice it. I don't know.
Well, I mean, it could be stress. Definitely
Okay.
could have been. I mean, that's it's entirely true. But I think that's kind of the movement that we're seeing now, is that it's not always stress. It's not always um, gonna like just go away when you're unstressed. And it's like, what does stress
Yeah.
mean to people? Like, how deep wired is it? Like, sure, like maybe we were just going through a stressful time. It's physical therapy school is a really stressful time. I completely dissociated from it. I don't remember it
Mm-hmm.
whatsoever. Um,
Very
um,
stressful.
and then maybe you're not stressed now, so it's fine. But
Yeah.
some people that's not the case. And honestly, clenching and grinding can be a symptom of airway issues. So kind of like a
Mm.
precursor to sleep apnea, if we want to call it that.
Oh,
And so it really is something that should be evaluated a little bit more than just slap a night guard on it. Like at
yes.
least a questionnaire, um, at least some more detailed scans, um, and then also understanding like this is a symptom, and sometimes even though the structures don't always correlate, that's the symptom, right? It's kind of like, okay, you have knee pain but your knee is fine, there's no structures are wrong, there's no torn ACL, nothing like that. Oh, it's fine, but no, but you still have knee pain, right? Same thing. It's like, okay, structures are fine but you're
Mm-hmm.
still clenching and grinding, like what's going on?
Right. Okay. So with the clenching and grinding, say they use a night guard. I think my boyfriend kind of did this a little bit. I don't know if he ever like clenched and grinded, but like snoring among like doing that what is that? Like I don't like chomping? Like it's kind of weird. I'm like, are you like talking to me? Like but is that like also a sign of like TMJD and like snoring and like you said airway issues? Like when someone's struggling with all of these symptoms, like what if everything just like compounds on itself? I imagine it's kind of like the pelvic floor where it's like you start with leakage and then all these other symptoms start compounding. Is it kind of like that for TMJD as well?
Yeah. And then
Interesting.
sometimes it can be hard to kind of back out of that
Yes.
because um, I'm not sure of a good analogy. Maybe you can think of one with the pelvic floor, but like with the jaw, because those muscle dysfunctions actually change the formation of your bite, change the formation of how your jaw develops over the
Mm.
time, then we're locked into like structural issues, right? So we not only have soft tissue issues with the muscles, but we have structural issues with how the bite's coming together, how the jaw is placed in the, like is the jaw set too far back? Is it impacting airway? Did the palate expand? If it didn't expand, people have deviated septums. That's actually how most deviated
Holy
septums
cow.
happen, is because like the palate is too small. So if the palate's too small, right, then the septum is going to deviate.
Oh my
Whereas if the
gosh.
palate grew, the septum would grow straight.
Yeah, I see adults now, they're like I think I can think of a few people that I've like met on social media that have like all of this extensive like adult dental work being done to their palates. And I'm like, "Oh, that's why you're not breathing and you're grinding and you have a lisp and you have all these other things going on." It's like, "Holy cow, where did it start?"
Yeah. Yeah.
Wow.
So yeah, there's a lot of things to kind of unpack, and that's why I really there's a lot of education that needs to happen, and it's kind of hard to get it all done.
It's like pelvic floor, man. Like
Yeah.
so let's compare it. So what everyone gets a Kegel to strengthen their pelvic floor in your postpartum. So you've probably heard this. What is similar for jaws? Like what are people being told to do as like the blanket thing and it's like stop doing that. You don't know if it's actually going to work for you.
Um, so I think of like two exercises. Like you get Kegels, right? And I can think of two exercises. People like to like push their hand, like oh, take your hand and push your jaw into your hand, like down,
Oh,
which to me like doesn't feel good,
no.
right? Um, and I understand the rationale behind that, right? We're trying to get the jaw depressors to
Yeah.
work and to kind of turn off the jaw elevators, which are your clenching muscles, but
Mm.
doesn't feel good,
Mhm.
and doesn't really actually do what they want it to do. And then the other one is also an isometric exercise where they're pushing your chin in like all directions. So you're opening up, and
Oh,
so you're pushing like down, side, up.
yeah.
And although I do use that exercise, it's and like maybe you think of this as also an exercise that you have in your arsenal. It's like, it's a good exercise in good context,
Yes.
like with good
Yes.
education around it, with like an actual, this is what we're doing with it.
Wow.
And I actually don't introduce that until way much much later when I'm working with somebody. It's usually one of the exercises we're using to like fine tune some stability and different ranges of motion.
Yeah. It's specific. It's
Yeah.
like for the person in front of you depending on whatever they're presenting with. Like it's not like go research YouTube University and go do these exercises because you've learned that you have jaw pain now. Who's normally prescribing those types of exercises? Is that like a dentist or like a orthodontist? Like who's telling them? Or I guess YouTube, but
The above, and even
yeah.
physical therapists.
Oh gosh. Okay.
Yeah.
I never learned those. Thank God I wasn't telling them.
But I mean, I definitely can relate to a lot of the things that I see when people are like, they're like, oh yeah, this is what I learned from this PT. I'm like, yeah, I was there
Mhm.
once. I'm sure you
Yep.
feel that way with Kegels. Like you just feel like
Yeah.
you didn't know any better, but you knew you wanted to know better.
Yes. Yes. Okay, switching routes here to just like women in general, right? So do you see any patterns or like trends around jaw pain with women specifically throughout their life, like pregnancy, postpartum? Like tell me about some patterns that are pretty typical that you see.
Yeah, all the above. Women are definitely way more affected than men, and whether that's actually they are truly affected or men just don't like to seek help for their problems is two different
Mm,
stories. But women definitely experience jaw pain way more frequently, and that's thought to be the influx of estrogen and progesterone, which men don't deal with those
interesting.
fluctuations.
Yeah.
It has to do with the estrogen receptors that are in the jaw itself. But we see a lot of times the story is like, oh, when I was 14, 15, that's when things really started to happen. I started to get more jaw clicking or pain. We see that around pregnancy. So, um, both pregnancy and postpartum, when we have those drastic changes in hormones, we see it around perimenopause, menopause. So I see like people who literally live their entire life and then they're like 60, they're like, why? And I'm like, well, there's no estrogen.
Estrogen receptors, that's so interesting. So
Yeah.
what is it doing? Like what's happening?
Well, just the flux, like influx of estrogen and progesterone, like how those change throughout your cycle is
Like the
affecting how
muscular
those,
effect?
yeah.
Okay. Wow.
So, some of my clients, we keep journals, like when I suspect that these things are happening, when like they're reporting flares that don't really match up with, like they kind of seem like no rhyme or reason flares. I'm
Mhm.
like, let's do some tracking. And a lot of
Yeah.
times they either are experiencing these flares with their period, their menstruation, or with their ovulation, which is when we see those two biggest fluctuations.
I wonder about women with like PCOS and
Hmm.
endometriosis if it's like way worse,
Yes.
right? And
Yeah.
that's like total body inflammation too. And I mean, symptoms of pelvic floor dysfunction are way worse in PCOS, endometriosis versus someone without it. Which is a perfect segue. All right, we're gonna get right into the pelvic floor and jaw connection. Okay,
Yeah.
tell us. So obviously, I can explain the pelvic floor side of things, and we're all one big tube.
Yeah.
So explain what you find as a jaw pain specialist and the women that you work with and pelvic floor issues. Are you screening for them? Do people talk about it or is it kind of like nothing? Hush hush.
The only time I actually, so I let me back up. Yes, there's a ton of connections. The
Mhm.
only time that I really like truly screen for it is when people like the true connection that gets me to be like, oh, let me talk about this,
Mhm.
outside of pregnancy and postpartum, is when somebody tells me they have to go pee more than once a night.
Mm,
And then I'm like, is this a
there you
pelvic
go.
floor issue, or is this like a sleep apnea issue? Because when people have disordered breathing at night, they'll pee more frequently at night. So it's
Mhm.
like then I'm trying to decipher which is it.
Mhm.
And so then I go and talk to them a little bit more about like their pelvic floor. And a lot of times there's also pelvic floor stuff going on. So then it makes it even harder to kind of figure out what's going on. And so it's just
Totally.
like one big giant puzzle, which I absolutely love. Um,
Yes.
but there's that connection. But the other thing too is when people are clenching and they can't seem to turn off their clenching, I'm like, what else is clenching? Because
Mm-hmm.
if you're clenching your jaw, you're probably clenching your butt and vice
Yeah.
versa.
Everything. You're
So
tensing your whole body. You're probably ab gripping, glute gripping, pelvic floor grip, toe gripping. That's a weird
yeah.
connection that I've like recently. I'm like, how often are you gripping your toes? Like,
Mm-hmm.
it's wild,
Yeah.
the connection. A lot of women that I work with, they also have a history of like jaw pain or whatever. And it's like insane how hard it is to get them to stop clenching. It's like one of the hardest habits to break. A lot of people can start habits, but breaking habits, so hard.
So hard. Yeah.
What do you
Yeah.
get? How do you find, or sorry, let me backtrack. What's helpful for you to recommend a patient to stop clenching? Like, I don't really clench a lot. Sometimes I'll recognize it like maybe when I'm like focusing on something and I'm like, "Oh my god, like let go. Like what's going on?" Like
Yeah.
what kind of signs are people like, "Okay, yep, that's more likely when you're going to be clenching."
We do a lot of habit tracking because it's so individualized to the person, like when they're going to clench. Um, I do a lot of habit tracking and we find out when people tend to clench more. Like when do
Mhm.
they tend to do like their oral fixations or oral habits, right? And then that's when they do more time checking, right? So
Mhm.
let's say um, somebody's like, oh yeah, whenever I'm on my computer, that's when I'm clenching more. I'm like, okay, set alarms. Let's do like posture breaks, like just break up the day because we're not meant to
Yep.
be sedentary people. We're not meant to that, all that kind of stuff. If it's
Yeah.
like because they're opening stressful emails, it's like, okay, well, let's talk about it. Like, can you take a bit, like we talk about what can we do to prepare the body for that, before they open up this stressful email or take this stressful call, right? And then also, um, some people it's a stressful situation. It's like anytime they go to see their in-laws, it's like, oh my gosh, I'm clenched my jaw to death, So then it's like it's just really kind of bringing some insight to those situations and what can they do about it. But then also like, do they need another provider to help them with that?
Mhm.
We're not, it takes a team, I think. I don't think it's like a one provider is going to fix all type of situation.
Yeah.
So I've definitely referred people to like, I'm like, that sounds like you need some good like EMDR, some good biofeedback.
Yeah.
Let's get that done.
Oh my goodness.
Yeah.
It's wild, just like the intimate connections with the body. And I think you treat with a very like wellness approach, right? Like habits, lifestyle, what are you doing day in and day out? Pain is so multifactorial. So is there other like outlier things that you're looking at that most overlook when it comes to treatment? Like nervous system, probably.
Yeah, I actually just had this conversation with a client this morning. I sent her a video on it, but just started up. We've kind of changed her exercises up twice, but she's still saying that she's in a lot of pain. And these are very gentle, very decompressive exercises that not a whole lot of people have problems with. And I don't mean that to be like, you know, gaslight her in any way. But
Mhm.
that means to me that, hey, this is a nervous system issue because, like you said,
Mhm.
pain is multifactorial. So, what's going on? Like, why does her body feel like she can't do these exercises? Why does her body get angry when she does these exercises? What is so deeply rooted that is preventing her from progressing? You know what I
Yeah.
mean? And I think that's what I would see. Like, I don't think maybe not every physical therapist looks like that or looks at that, where they're like, oh, oh, she's just too far gone. Who
Right.
knows?
Right.
It's all her fault. She's not trying hard enough, X, Y, and Z. And I'm not looking at it like that. I'm looking at it
Right.
like, okay, this is a body that's really been in chronic pain for a while and screaming for help and like literally screaming for help.
Literally. Well,
Yeah.
I was just talking about this yesterday on with another podcast, and it's like a body cannot heal in a state of chronic fight or flight.
Yeah.
Like if your body's in a constant state of tension, that's how it feels safe. You unraveling that tension is not safe for the body. It is safe. We know that. But when you're in the moment, that is unsafe for the body. And teetering that fine line between like what feels good and like what doesn't is really hard.
Yeah.
My goodness.
Yeah.
I have a random question. So at night, I think I like learned this from you on honestly, like watching your videos and stuff. I'm like, What is my tongue position? So, what is the correct tongue position that we need to have? And what does it look like?
Yeah. So the tip of your tongue is right behind your front teeth, but not touching your front teeth. I think a lot of people
Oh gosh.
think that just because it's up there, yeah, but we don't want any forward pushing onto the teeth.
Wait, I've been doing that. I'm like, I know my tongue is supposed to be behind my teeth, but I'm like, at night, I'm like pushing it in there. So I'm not supposed to push it in there.
Not into your front teeth, like forward into your front teeth.
So just
Um,
like floating or
uh,
resting at the roof of my mouth.
it's push. Yeah, your tongue is pushing up, right? So if you think of it like your tongue is supposed to be touching almost your entire heart. Well, not almost. It is supposed to be touching your entire hard palate, but not really pushing out onto your teeth.
I'm like practicing. Okay, so while I'm at rest,
Yeah,
that's where she's hanging out.
she should be. Yeah,
Okay.
suctioned up there to the hard
Why?
palate, not really pushing out onto any teeth, just resting up there. And then the teeth are about 2 millimeters apart,
Okay. This is awkward.
and then your lips closed
So just chilling. It feels unnatural.
because you
Normally
haven't done
my
it.
tongue is at the bottom and my teeth are closed.
Yeah.
Okay. So do you do this like all day long? Are you like conscious of it?
Conscious of it. I definitely have my own limitations to having this
Hmm.
particular, like, quote unquote, ideal posture, right? Like, I do have a tongue tie that prevents me from getting a good portion of my tongue up to the roof of my mouth, which I at some point probably will get rectified. It really depends on whether my oldest son, if he oldest son like I have two, my oldest kid, needs a revision when he's older. We'll be tongue tie release buddies together,
Mm.
but I don't really need to in terms of
Hmm.
function. But yeah,
Yeah.
ideally that's where your tongue is.
Okay, so if someone can't put their tongue on the roof of their mouth, that means that they're tongue tied.
No, it just means that there's dysfunction. So the real definition of a tongue tie is if there's limited function, right? But
Mm.
sometimes it's just like teaching those muscles how to work and coordinate, right? We talked about how swallowing was done, you figured that out when you were like 11 weeks, 12 weeks in utero, right?
Hmm.
So if we teach them, does that change the function? Does it change how you feel? And if it
Hmm.
does change the function, how it feels, it's like not really a tongue tie. Does that make sense?
Okay. Yeah.
Yeah.
Do your kiddos have tongue ties?
Yeah, my oldest one, he needed to have his tongue tie released in order to breastfeed. Um, and he probably still is a little. We're just kind of seeing how that pans out. But and then my youngest is probably tongue tied, kind of like me, more posteriorly, just based on some of her feeding difficulties with like transition
Hmm.
to food and taking the bottle. But we haven't had to do anything yet because she's still quote unquote like functioning well, if that makes sense. Like
Okay. Yeah.
as long as there's no issues with function and you're able to work through the function with exercises and whatnot, there's really no need to release the tissue.
Okay. And is there a point in your life where is anyone ever too like far gone? Like, can you always correct these things? Like, no matter how old you get, or is there like a time period where like, yeah, they're like, oh yeah, we're not gonna do that.
That's where the soft tissue issues and the structural issues come in, right?
Mm,
So never too far gone to work on the soft tissue issues. However, the structural issues, because a lot of those are in the dental world and not dental insurance covers like zilch, right?
yeah.
That's where it can become challenging. Is fixing some of those structural issues. Just get a little pricey, and not everybody has uh, the financial means to do that.
Hmm.
But that's where people get treatment plans that are 20, 30, 40, $50,000, and they're like, well, how do I fund this? And well, some people just don't.
Why isn't that covered? That's insane, especially if it's impairing your function, right? It's like knee surgery, and knee surgery is covered by insurance if you can't walk. It's like, well, I can't eat, I can't sleep.
Yeah, you'd think. I don't know.
That's wild.
Yeah, it is. It
I
really is.
hate. Oh my God. I'm
Yeah,
not
it
even
is.
going down that rabbit hole.
And yeah, and then the older population is definitely a little bit more at a disadvantage because of just how dentistry and orthodontics was done years ago.
Mm.
You know, I see a lot of people who have, you know, a lot of work done in their mouth. We're talking implants, crowns, um,
I'm so
like
interested about these things.
so much work done. And the problem is that implants impact how we can move teeth later in life. We can't move the implants are there. So let's say if somebody needed to or would want to have orthodontics after having an implant, it's a different treatment plan. And
Wow.
sometimes the goal can't really be obtained. Like we're kind of doing some uh like we're doing not the ideal, whatever that, I can't think of the word right now, call it mom brain, but whatever that is, we're just kind of going with like the next best treatment option.
Gotcha. Okay, so there's obviously a lot of correlation with like jaw pain and like headaches, migraines, things like that. So I know we've talked a lot about like root cause, like what came first? Is it coming from the jaw? Actually, one of my someone who like works on my team, she's getting her wisdom teeth out because she mentions that she gets like chronic migraines and like jaw pain and all of that. So like what's your take on that? Is that like next best solution? Like people are just like, okay, let's go pull some teeth. Like is it coming from the wisdom teeth or is it coming from somewhere else? And we don't really know.
um like that's always a possibility. Like wisdom pain with wisdom teeth is always a possibility. And this is kind of what I at least tell people. It's like, okay, if your insurance is going to cover it, like
Go for
great,
it.
go for it. Like it's not going to hurt. Same thing with like a deviated septum surgery. Like if your insurance is going to cover it, great. Like move forward, right? um it gets more tricky when those procedures aren't covered by somebody's insurance, because then we're really trying to figure out what would be the next best step in terms of like not only how they feel but also um you know, just financial, because that stuff costs a lot.
Yeah.
Yeah.
Interesting. So I just listened to a podcast actually yesterday about, you've probably heard of the root cause documentary and like root canals and
Oh,
like
yeah.
cancer and all of this kind of stuff. So I was listening to a documentary yesterday or a podcast, and they're talking about root canals and implants and the dental work and all of the stuff that you have done just because like somebody told you like that's the next best step.
Yeah.
What is your take on like root canals and like the dental work that you have done literally just to your teeth, and how is that correlated with like jaw issues?
I mean, obviously there, if you need a root canal, like there's going to be very obvious positive findings. Like we have
Mhm.
the technology now to know that. Like we don't have, like we used to have just primitive tests, like, oh, if the tooth was sensitive to hot or cold, or if the tooth was sensitive to like a certain vibration. I mean, I don't know all the tests, but um, those are very primitive. Like now we have
Yeah.
imaging, especially if you're going to go to like a specialist who does root canals, which is an endodontist, which I'll do another soapbox in a minute. But the they have, most of them have scans that they can do to identify infections of like that
Mm,
nerve. Like they can see it. In which case, like then they'll go ahead and remove the nerve, which is what a root canal is. If like you're not seeing any positive findings on any test, like why?
like anything, right?
Like
Like
anything.
don't move forward.
Like that, why are we speculating that something's wrong when there's clearly evidence that nothing is wrong? So it's like,
Mhm.
what other things are causing the jaw pain? So I just literally today talked to my endodontist who refers to me, and letting him know about a patient that I'm seeing of his. And but this woman was given antibiotics because there was a speculated infection because of tooth pain. She had tooth pain, so given antibiotics helped, but then didn't help. Had a root canal, helped, but then didn't help. Had another root canal because they speculated that it wasn't done correctly the first time, so they did another root canal. Then they're like, well, we think it might be neurological, so she got 3 rounds of Botox.
Oh my god.
Yeah, each one helped, but then didn't. Helped, but then didn't. And then she went to this endodontist, and he's like, none of my tests are like screaming positive. Like, there's nothing wrong, but she still has tooth pain. And the things that I'm seeing on evaluation are, one, she clenches a lot and her teeth are always touching. So that tooth could be sensitivity just from contact, like a ton of contact. And then also, she, lower teeth can be a referred pain pattern from the masseter. So it's like, is her masseter that's been like Botox the shit out of,
Yes.
now a problem?
Oh my gosh.
So, I
So why
mean,
not just pull the tooth? Why are we doing root canals? Like,
because you
why are
can,
so many?
well, if you pull the tooth for tooth pain like that, it's still, I've also seen this, is they've gotten the tooth pulled and there's still pain there because it's like phantom pain. It's like, just because, and that's what I'm saying is like the masseter and temporalis, like masseter can refer to upper and lower molars, and then temporalis can refer to upper molars. Like if those muscles are creating that referred pain pattern to that specific tooth and only that tooth, it can look like a dental issue, but it's not. And so even though you pull like a really good tooth,
Wow.
and then it's
Don't
not.
do it.
Yeah.
Yeah, go see Liana first.
Or just see somebody, please.
Don't just go get a root canal or your tooth pulled.
Right.
Moral of the story.
Moral of the story.
Shit. That's insane. What do you think is like most commonly misdiagnosed with like jaw issues that people are just like, I think you should just go see a physical therapist first? Like me, I'm like, don't go to surgery. Don't just go to a urologist. Don't just go to an OBGYN every single time something's wrong. Like, just go to a physical therapist first.
I wish more dentists did that. Um, but when I do give lunch and learns, because I love doing lunch and learns with dentists and just teaching them, at least what I know, so we can collaborate care. I love collaborating care. Like I literally, about a patient that I had yesterday, I texted like 5 dentists that I have on speed dial because I'm like, I need to talk this out.
Mm-hmm.
But what I like them to know is like, when is there the possibility that all of what they're feeling is a movement issue, which 90% of people it is. It's a muscular dysfunction issue, right? So, I teach them like one, two, like at least 2 to 3 very easy screens that they can do in the dental chair with somebody who's got popping, clicking, somebody who's got jaw pain, headaches, who is clenching or grinding at night. And I literally tell them, use these screens to like help the person understand like what's going on is potentially mostly muscular, right? And then let me do the evaluation for them, right? Because more often than not, like my evaluation is looking at things that they are not looking at, which is another, I think, misconception people think about is they're like, oh, my dentist, my jaw, like this is, they're going to know what's going on. People like dentists only know about teeth.
Mm-hmm.
Like I remember husband, I'm like, do you know how to like even palpate the sternocleidomastoid or the suboccipitals, or like they know masseter, temporalis. They don't even really know like where the medial or lateral pterygoids are. Like, I mean, they know where
Yeah.
they are anatomically, but they don't know really where to palpate them in their mouth, in somebody's mouth. Um, and so it's just they don't really have that knowledge, and they could if that was what was taught to them, but they don't, right? And they don't really know how to identify those poor movement patterns. Like they know, oh yeah, the jaw's going off to the right side, but they don't know what to do about it,
Mm-hmm.
right?
Mm-hmm.
So yeah, I teach them some very basic, like, here, these 3 things on your patient, if they're showing these things, like just send them so I can
Yeah.
give you a better report back. And
Yeah.
sometimes there's still things that we're working on team wise, like, what type of night guard that person might need, or like, do they need orthodontic treatment? Do I think that orthodontic treatment will benefit them in terms of how their jaw feels? Because that's also not a given too. But yeah, yeah, I ask, you might
Yeah.
have to do your own research. And I even asked like one of my clinicians who's a registered dental hygienist, I was like, do you think that's partly because like dentists just don't have the knowledge, or dentists want to keep things in house? And she said both.
Mm-hmm.
They don't have the knowledge, plus they don't really want to, like, if
Prefer.
I get referred a patient and then they don't need them for further dental workup, that's not money in their pocket.
Yeah. I can see that. Every profession. Because like we're like a tree, right? Like you're in the world of dentistry and orthodontics and endodontics and all that. And I'm in the world of birth and women's health and urology and GI and urogyne and all of
Yeah.
that. And it's like, well, no surgery is less money in their pocket. So it's unfortunate.
Yeah, it is. It's really unfortunate. And I think that on top of that, I was just talking to my brother about this because, well, he's not any of this that we're talking about, but he is a surgeon. And, just if insurances don't reimburse, like they need more.
Yep.
And that's the ugly truth.
Yep. And that's why we do what we do.
Yeah.
Amazing. Well, I have a few questions left. First question would be, what did you what did you know before about jaw pain that people told you and then you had to go figure out on your own, right? Like what was that like blueprint? What did that look like in terms of jaw issues that you're like, "Wait, hold up. Like that actually is not true. Like let me go rewrite the story and go actually help people."
Oh, not true. So many things.
Mhm.
So
Like what you
taking
learned in school versus like what's actually true in front of the patient.
the one thing I think that at least when we're talking about physical therapy is that like joint mobilizations are like the go-to thing. Like let's like move the crap out of that joint. Like no, the vast majority of people that I see with jaw pain are hypermobile. Like the joints are, maybe not the rest of their body, but their TMJs are hypermobile.
Mm.
And so if somebody has normal range of motion, and I consider normal range of motion like 35 to 45 millimeters, like you shouldn't be mobbing anybody.
Mm. Wow. Just
Like you
like the
wouldn't
pelvic
you wouldn't
floor.
mob a normal hip range motion.
Yeah.
So why are you
And I think
mobilizing
that
the
so
jaw?
many PTs don't even know what normal is for the jaw. They're just like, well, I learned this in school. I'm going to try it because the patient has pain.
Yep.
Like, oh, slap the band aid on it.
Yep.
Wow. That's good to know. All right, last question. And it's a question I ask every person on this podcast. What's one rule or a piece of advice, small blueprint that you were told as a little girl growing up, as an adult woman now, pregnant, postpartum mom, whatever, era of life, that you've since thrown out? And then what have you replaced it with? Can be health or anything. Work doesn't have to be. Anything you want.
Anything I want. I don't know if it was necessarily that I was taught this or it was a belief system that I had for a long time, but really like kind of like all or nothing mentality,
Mhm.
right? Needing to show up 100%. Um, and I used to do that with diet, used to do that with exercise, used to do that with, oh my gosh, pretty much every aspect of my life. It was either all or it was nothing. And I've
Mhm.
learned that, like, 80/20 is a pretty awesome split,
It really
or
is.
like, I think we talked about this because you did my pelvic floor stuff with me. It was like, I'm just going to open it and do like one or two exercises. And that's what I've
Mhm.
got time for. And I'm
Yep.
still going to count that as a win. So I think like reframing that has really helped me not be so hard on myself.
Yeah. I love that. That's so good. And being like my population probably listening to this or audience is like they struggle with that. It really is hard, especially when you've done something a certain way for so long and then your world gets rocked. Like you have babies and multiple babies, and then babies that only want to breastfeed. And like your situation where you're like, Courtney, I can't do these things. Like I have to do a 10-minute movement snack. That's all I got in me today. And I'm like, that, you know what? That's a W. We're going to take that.
Yep. Yep.
I love that. Well, thank you so much for sharing that. And thank you for coming on my podcast today. It's been a joy.
Thank you for having me.
Where can people find you if they want to learn from you, work with you? Like, where are you at?
Yeah. Instagram, _jaw pain doc. That's me.
I love it. All right, guys, go give her a follow. She is an incredible source of knowledge, got lots of resources. Listen, I learned how to have correct tongue posture from this woman. So, you guys, go watch her videos, go take some nuggets away from her. And thank you so much for being here, Liana.
Thank you.